it's really hard to go up to someone and admit a struggle, admit a weakness, admit a mistake that you've made.
Jenna is a recent graduate from Zaytuna College, an Islamic university in the Bay Area. She hopes to become an art therapist.
Art is very often used as a form of resistance, as a form of survival even. I wanted to use creativity and just artistic outlets to help heal and guide people.
When most people think of therapy, they might imagine a couch and shrink on the other end. Art therapy seeks to change that perception.
So art therapy is similar to talk therapy, except instead of the client only having talking as their mode of expression and communication, they also have the visual arts.
As helpful as it can be to verbalize things, it can be very, very difficult. And there actually have been a lot of different studies and research that has shown that sometimes, and this isn't always the case, but sometimes talking about something can re-traumatize you.
It can be scary to be asked a direct question about someone's trauma or their feelings, but it can be a little safer to say, okay, pick a color that represents how you're feeling right now and make a mark on the page or a shape that expresses what's going on for you inside right now.
Although Jana wants to become an art therapist, her relationship with the mental health industry wasn't always like this.
And ironically enough, someone who works in the field now and is studying the field, I was definitely part of the stigma of just, I don't need to go to therapy, I'm fine. You go to therapy if you have problems.
Jana's experience is just one example of how common mental health stigma is amongst minority communities.
Muslims, I find, or really just anyone from a kind of faith-based community, is oftentimes what I've heard is mental health is seen as a weakness of faith.
Along with the feelings of being shamed, there is discrimination from the mental health industry itself.
My clients that come from marginalized backgrounds and my clients of color definitely report to me more difficulties getting respectful treatment in treatment centers or hospitals.
People like Tonya and Jana are trying to use art therapy to shift the narrative surrounding the mental health industry.
When I sit down with a client and just do some art and we get messy, I consider myself on the journey with them. I don't consider myself the expert. I think that is the most effective in building rapport with all clients, but especially clients who have had some past trauma from working with doctors or mental health clinicians.
Using different mediums, using visual things that are going to stimulate your brain and your body in a way that words don't always reach, I find is really helpful. Anyone who is just kind of unable to talk about it or doesn't always feel comfortable in those types of spaces, it speaks for the wordless in a way.